And welcome, everybody. I can't believe this is our 11th annual poster session. And what I can't believe even more is that it's our third virtual poster session. You've all made it through a really tough year, and all of us are very, very proud of the production and the work that all of you have done, the brilliance you've shown, and especially your commitment to teamwork and collaboration. That's represented today. We've got 15 teams and representing 110 different students from what we think are 8 to 10 different professions. All this work reflects such timely issues. The IPTE, our Interprofessional Team Immersion, focused on the impact of long COVID. We also focused on, or I should say you focused on, telecollaboration and how that works across programs. And we did this IPTE this year with folks from Rosalind Franklin and also from Tufts in Massachusetts. And this is an example of innovation cross-institution that we will continue to do, and we believe that all students and faculty really benefit from it. We also have focused on innovative interprofessional leadership, and you'll see that in a lot of the posters today. We also have presentations today, and we've seen an increase over the last couple of years of student-led research and scholarship, and students involved in faculty scholarship as well. And we're learning more about how teamwork positively affects patients. And we're also learning a lot about the impact of what you're learning on campus about interprofessional competencies is impacting professional workforce practice. So we're very excited to see the posters today and to talk with you. And now it is my distinct pleasure to introduce Associate Provost for Academic Affairs and former Director of the Physical Therapy Program, Dr. Mike Shelton. Welcome, Mike.
Thank you, Shelley. Good afternoon, everybody. It's an honor and privilege to add my welcome to the Center of Excellence in Collaborative Education student poster session. While I currently work in the Provost's office, as Shelley mentioned, the majority of my career at UNE has been in the Department of Physical Therapy, where I began my career at UNE as a faculty member in 1990 and served as program director for about 20 years. In this context, I believe I have some great perspective on the amazing growth and maturation of the center, including the formal integration of interprofessional education into the curriculum across the various health professions programs at the university. Back in the day, as they say, the collaboration across programs that is now just part of your daily lives took some time to develop. There was always interest in collaboration from the beginning, but translating this energy and interest into meaningful and impactful program across the entire university required and continues to require an enormous amount of behind-the-scenes work. We have Dr. Cohen Conrad, Chris Hall, Michelle Cody, and countless faculty and professional staff champions over the years to thank for where we are today. And where are we today? The center has been recently organizationally moved to the Office of the Provost to signal its university-wide impact and presence. Collaborative education and practice is happening everywhere, such as the robust educational programming in the Interprofessional Simulation and Innovation Center, to our work in the community, such as our healthcare partnership with the Westbrook Housing Authority for Aging Mainers. You may have also heard about the major gift from the Harold Alfond Foundation to move the medical school to the Portland campus. This gift will also support the creation of an Institute for Interprofessional Education and Practice on the Portland campus. And having the medical school on the Portland campus will provide amazing opportunities to further develop innovative education, practice, scholarship, and research opportunities for the entire university. Faculty and administrators from other colleges and universities across the United States come to UNE to learn how we do what we do, and often comment that they struggle to achieve the same outcomes at their institutions because of the entrenched disciplinary silos at their institutions. At UNE, collaboration is just part of who we are. And while you may think, what's the big deal? It is a big deal. UNE is truly unique in this regard. And you may say, Mike, I get that you say all these glowing things given your role at UNE, but it's not just me saying this. For example, Barbara Brandt, the director of the National Center for Interprofessional Practice and Education, had this to say about UNE Center for Interprofessional Education and Practice at this year's Nexus Summit, an annual national conference that's sponsored by that center. And I'm going to perhaps embarrass Dr. Cohen-Conrad a little bit here with these remarks. Dr. Cohen-Conrad led an extraordinary plenary that focused on patient, family, and community engagement in their own health, showcasing the exemplary UNE IPE programs. UNE faculty, professional staff, and students made significant contributions to the quality of this year's Nexus Summit, demonstrating their cutting-edge leadership in the field of interprofessional practice and education. And today's poster session is another shining example. Involvement of students from every health professions program at UNE, an array of faculty mentors from across the various disciplines. Today's program looks outstanding, and I wish to extend my congratulations to all of you. So I'm really looking forward to today's presentation. It's an honor and privilege again to be here. And it is my pleasure to introduce Dr. Karen Hausknecht, the Associate Provost for Research and Scholarship and Professor of Pharmacology, to offer her remarks.
Good afternoon. My name is Karen Hausknecht, and I am Professor and Associate Provost for Research and Scholarship here at UNE. I want to welcome all of you to this signature CECE event and share my congratulations to the student teams who are presenting their work today. Scholarly inquiry, innovative problem solving, interprofessional collaboration, and sharing new knowledge are foundational components of the UNE educational experience, and they also inform future clinical practice. I'm delighted to see interprofessional teams comprised of students from 8 different programs spanning our UNE campuses presenting their work today. As I read the abstracts for the posters, I was really impressed by the breadth of the work being presented, covering important real-world topics such as telecollaboration, COVID-19 and malaria-related research that impact communities globally as well as locally here in Maine. I also want to take a moment to recognize the faculty and professional staff mentors who work so hard every day with our students to help guide their learning and research experiences. And also recognize the CECE team for organizing yet another great virtual event. Finally, I want to give a shout out to those who provide financial support to this and other research efforts at the university. In addition to the UNE Office of Research and Scholarship, this work was supported by funding from Brian and Deborah Dallaire, Rosalind Franklin University, and Maine AHEC. And so with that, I just want to congratulate the students again on their important work and wish you all the best for a fun and informative poster session. Thank you.
Thank you particularly to Mike and Karen for those fantastic remarks. Thanks for being here and supporting our efforts. My name is Chris Hall. I'm the program coordinator here at CECE, and I'm here to let you know how best to enjoy the poster session. So as you can see, there are 3 breakout rooms that you'll be invited to travel to under your own power. The first breakout room is concerned with the interprofessional team Immersion, which concentrated on telecollaboration and long COVID this semester. The second breakout room is leadership, and the third is scholarship. And they all have some really fantastic presentations. As you see from the visual here, the events in yellow, surrounded by blue, connected by the blue line, that represents what folks on the live stream and on Facebook Live will see. And so you'll see our audio-visual team moving through your breakout rooms as they present the live stream and the Facebook Live. And so you can stay in your track, or you can move around. It's completely up to you. You're welcome to select the breakout room of your choice at any given time. And we obviously will strive to stay on time, but you'll know when it is time, when you have an opportunity to move between sessions if you want to. And so without further ado, I think, Lee, I would invite you to go ahead and open up the breakout rooms and invite you all to move to the room of your choice.
Right, so here we go. So while we're welcoming everybody in, I know people are making their way through different rooms. This is the telecollaboration track, and we have several of our IPTE teams here today. And so we'd like to start this off during this transition time with just a quick quote from one of our alumni that spoke about the value of IPE in their education here at UNE, and now they work in a clinical setting. So again, I'd like to welcome everybody. And with me today, like I said, I'm Michelle Cody. I work with CECE. And with me today, I have Sarah Garber from Rosalind Franklin University. And she'll be here to help answer questions and get the conversation going after this presentation. So this first presentation we have, here's the poster. It's about connection, lessons from interprofessional immersion. And so if any of the team members on this presentation are here today, if you want to give a wave here on screen so people can see who you are, welcome, and thank you for participating in this presentation. And now we'll show your video.
Hello, everyone. My name is Jillian Batista, and I'm a third-year Doctor of Physical Therapy student at UNE. This semester, myself and multiple other disciplines participated in interprofessional team immersion. My team consisted of social work, occupational therapy, osteopathic medicine, allopathic medicine, physician assistant, and physical therapy. Our client was Amanda, who presented with long COVID. Amanda was hospitalized for 11 days and shortly after was discharged from the hospital and began experiencing excessive fatigue, cough, brain fog, short of breath, hair loss, loss of taste and smell, and debilitating migraine headaches. Our team goal was to work with one another to learn more about Amanda's circumstances and make recommendations for the next step in her care. This immersion allowed each of us to gain a better understanding of each other's professional roles, develop better collaboration skills, and to provide the best care to our patient. A main takeaway was learning how to work through trial and error with a variety of different skill sets. Below, we listed what we took away from this experience, our challenges and how we address them, and the pros and cons of telehealth. In addition, there's comments on the right side of our poster, and that gives you a brief statement from each discipline about what they took away from this experience. Thank you.
All right, everybody. So that was their presentation. We have a couple of minutes here to have some conversation and reflections. And if any of the presenters that were part of this, if you'd like to elaborate or speak more about your presentation, you have the floor.
Me or you, Dave, or both of us?
Go for it. You're rocking it.
Okay. Yeah, so just kind of touch on what I also said in the video. We just did the interprofessional team immersion, and we came together, I want to say maybe 7 times, and just planned how we were going to best care for our patient. And it was really nice. I think at first everyone was a little bit nervous and kind of hesitant, but once we started explaining what each discipline did and how we can help, I think really opened the doors, and it was a really great experience.
Thanks, Jillian. I can ask a quick question. What do you think was the most important characteristic in bringing everybody together to work on the same page?
I think communication. I think there was hesitancy of what we wanted to say and what we wanted to do, but we wanted to make sure that we were respecting each other's discipline. So I think just being respectful and communicating was a big thing for our group. I don't know, Dave, if you have anything to add there.
Yeah, with different, slightly overlapping professions coming together, one of the challenges was when we had a slight misalignment of perspective on what might be the best way to go forward or who might be the best person to go forward with it. Being able to work that out interprofessionally to say, all right, this is the consensus that we're forming, and this is the person who should best spearhead this part of patient care, client care. That was definitely a skill set that we developed. And then in presenting our different perspectives on client care to the clients, having kind of central voices that would come through each one of the different meetings so that they wouldn't just have a whole new group of faces every single time, that they had at least one or two people who would be there in each of the meetings, say, all right, we're going to introduce the new specialists that are coming in this week. We're going to be sure that your questions get back not just to the 4 people here that you're asking it to, but to everyone kind of behind the scenes. And having that kind of central thread running through each of the different appointments with our client seemed also really to put our client at ease and help facilitate getting communication both directions to the group and from the group, in addition to those professionals who could make it to a given meeting.
All right, we have Mike Sheldon has his hand up with a question.
Yeah, this may be a follow-up to what David just said, but I'm kind of curious in this realm. Obviously, long COVID is a new term, and I've heard some recent discussions that there are different forms of long COVID, and probably now trying to tease out sort of the different presentations in that realm. And I am kind of curious how you decided on a consistent communication plan when literally you all were learning in real time as well, right? Trying to keep up with all the contemporary information that was coming out, false information, parsing through, information that was incorrect versus, really trying to provide the patient the best information at the time, and how you all coordinated that.
We have a couple of, oh, sorry, go ahead, David.
Yeah, I can speak to that just briefly. We didn't have any particularly strident disagreements, so we had a whole lot of good intellectual questioning where we asked, all right, what is the best way forward? I think this might be this particular way. And others say, like, okay, from my background as an osteopath, as a physician, as whatever it happened to be, they would be able to share there. And thankfully, we didn't have any such strong opinions that there became a clashing of professions. So I'm certain that in further repetitions of this with other groups, that would be inevitable. But in our limited experience, we don't really have very much of that. And to your point, Mike, about a lot of this information being very new, we did a fair amount of research on our own and then try to find our own answers and bring it to the group for the next set of meetings. One of the challenges we had there was having 2 sample appointments in one evening. We only had a few minutes in between, the first appointment and the second, to do anything more than just kind of catch our breath and run ideas past each other. So in a more real world version of that, we would have definitely had more time to look up that information, which could have maybe led to other answers too. But thankfully, we didn't really have any strident clashes of professional doctrine perspectives or a jurisdiction.
And sorry, I know we have other questions in the chat, but I think we've got to transition to our next presentation here. So everybody either hang tight, or if you want to navigate to another room, feel free to do that in this next minute.
We'll be presenting United Plan of Care, Interprofessional Approach to Long COVID through Telehealth. The students involved are Elizabeth Bocal, Annalise DePaulo, Aaron Fatima, Nicholas Goodrich, Brenna Keefe, Anna Marianishvili, Cam Tai, supervised by Sarah Gerber. Purpose of the study is to examine diverse perspectives with which each member of the interprofessional healthcare team assesses the care study of long COVID. History of present illness: 39-year-old female hospitalized for 11 days for a diagnosis of COVID. While admitted, she was placed in the ICU and intubated due to significant drop in her O2 levels. Since leaving the hospital, she has experienced excessive fatigue, cough, brain fog, shortness of breath, with and without exertion, hair loss, loss of smell and taste, and debilitating migraines. Due to physical and mental toll of long COVID, she has not been able to return to work as a sales clerk at Home Depot, where she works with her husband, M. Medications she takes are lisinopril, albuterol inhaler, multivitamins. Her vitals are elevated: BP 138/72, heart rate is at 92, which is elevated, respiratory rate elevated at 25, O2 stat is a little bit low at 95%, temperature is normal at 98.7, and pain at worst is a 6 out of 10, but right now is a 4 out of 10. I will popcorn it over to my colleague.
Thank you so much, Anna. So as you can tell, this case was very complex, and I'd like to share on behalf of my team a quote from our patient. She says, I guess, it's just really hard to cope and it's just been a lot for the family. Again, like I said, I haven't been myself and it's just been hard on the boys and hard on my partner, M. I haven't really talked to anyone about it. I just feel like right now I'm just barely getting through the day, that's all I'm doing. That's all I'm doing. This was shared by our patient, a 39-year-old female who's dealing with the effects of long haul COVID. As a group, a common overarching consensus reached was the importance of this collaborative approach and knowledge of roles while we were acting in this interdisciplinary setting, even though it was a simulation. While working with a client over telehealth in Zoom, it was really important for us to know the patient and keep this interaction fluid. Even though most of us are type A and wanted to go in with our own agendas and questions for the best care possible, we really had to let the patient guide the process and radically listen. So each profession offers this unique approach and point of view to contribute to patient care and to achieve the very best patient outcomes. But when we work together, the different professions serve to help shape our view of the whole patient. Being conscientious of the limited access to healthcare and health maintenance over the whole process, especially in rural care, we knew that we had to come together for this multi-pronged approach. And as you can tell in our poster, the title, This United Plan of Care, it's really important that we work together, and we hope that you can tell this from our approach and our objective.
So, hi, my name is Carrie Brown, and I'm in the osteopathic medical school. There's Cassie Brandow in the OT school and Alec Daigle in dentistry medicine. We worked together on a project with a simulated patient who had long COVID. The name of our poster is The Many Consequences of Long-Term COVID, a team effort. This poster discusses the many possible consequences of long COVID and how our team approach was used to provide treatment to our patient. Our team included a variety of professions and engaged through a telehealth platform in a simulated case.
Our team began by introducing our different disciplines and sharing which aspects of the case we would like to know more about. Our team included dentists, occupational therapists, physician assistants, doctor of osteopathic medicine, pharmacy, and social work. Through collaboration and communication, our team fostered a comprehensive plan of our expectations for each of our client interactions. Through the course of the interactions with our clients, we included the following interventions: medication changes, energy reduction techniques, migraine management, education on work resources, and other additional family resources.
We came up with 3 goals of team-based healthcare. The first being communication. We think there's a problem in healthcare that can lead to repetitive tests and decreased efficiency. The second goal was define roles. This is so every provider feels valued and is using their skill set to the greatest extent. This can also stop overlap between providers giving the same patient care and can increase the team efficiency. The last is a shared goal. This is to make sure every provider is working on the same goal, and this can make the team much more effective. We learned about the ongoing battle patients have with long COVID and how prevalent it can be in the population. We learned how extremely effective team-based healthcare can be. And we also learned about the other healthcare professions and how to communicate effectively. We would like to acknowledge Dr. Mayer, Dr. Afrat, and Professor Crampsey for their mentorship and the IPTI program for this event.
Okay, our poster is entitled An Interprofessional Approach to Long COVID, a glimpse into motivational interviewing and long-term pain management. I'm Jake McHugh, a PA student. On my team is Ali Kirker, an OT student, Sneha Patel, a PA student, and Zainab Jabor, a PharmD student. To just introduce our subject, it's about long COVID. It's something that about 23% of people experience after they experience an acute episode of COVID. The symptoms of long COVID can be very non-specific, including headache, migraine, and fatigue. It's not very well understood, and some patients can experience isolation and depression and anxiety. Our patient was one of these people experiencing these symptoms. And she was also having some dyspnea on exertion and other emotional problems as well. So we met with her over a series of telehealth appointments and got to know her a little bit better and came up with some interventions to share with her, which Ali's going to speak more about.
And so some of the clinical interventions that we were able to introduce to our patient during our second session address fatigue management. So we showed her how to use a Google Chrome extension called dark mode, which allows everything in your browser to change to darker colors to help improve with eye fatigue. And then we also introduced an extension called Visor, which allows you to highlight smaller sections on your window in order to have a more focused reading experience. We also addressed some pain management interventions, including stress reduction was a big one for our client, and also ways to improve sleep, diet, exercise as well.
So some non-pharmacological pain managements were incorporated. This where we can look at lifestyle interventions or cognitive behavioral therapy changes. We could have focused on improving sleep, diet, or exercise habits. We could have also intervented with some medications like steroids that some patients found helpful, including more stress-reducing activities, Botox injections, while also having more connections with other patients that are on long COVID. Things like meditation and acupuncture will also be helpful.
So some of our conclusions from this experience were the importance of building rapport with our patient was super important through active listening, validating the patient's experience, and just respecting their own understanding of their illness and coming into it with an open mind. And we'd like to acknowledge and thank the UNE Center for Excellence in Collaborative Education for bringing our team together.
Okay, so today we'll be talking about the impact of interprofessional team immersion on a patient with long-term COVID. So we've all heard about COVID by now, but long-term COVID seems to be something that is a lot newer to us. It's basically defined as any patient who reports continued symptoms for at least 4 weeks after receiving a COVID diagnosis. Patients can range from those who had really severe symptoms to those who had mild symptoms. So we worked with different professions to basically discover more about long COVID via telehealth.
So our patient is Amanda. She's a 39-year-old female who contracted COVID-19. She was in hospital for about 6 days, and 6 months after the fact that she was admitted, she was having symptoms of just long-term COVID. Her worst symptoms is a migraine headache that just wouldn't go away. And her goal is to be free of migraine and to interact with her family again.
During this time as a team, we did a diverse knowledge of skills. We listened to different perspectives from different team members. And our goal was towards patient need and patient-centered care and collaboration to make sure patient is safe.
An advantage as a physical therapy student to this LP team immersion thing is that the patient's symptoms is unbiased. She appears how she is. And the disadvantage is that I was unable to get my hands on her or have her do some tests that I deem unsafe if she doesn't have a professional with her.
Advantages of being a PA student during this project is that I got to see how advantageous telehealth is for a patient who isn't feeling well and that they don't have to make the extra trip to the clinic. Disadvantage is that with PA surrounding a patient report so much, it can be hard to establish this over a computer screen.
An advantage of telehealth and occupational therapy is the flexibility it provides. For example, as Hannah said, it enables the patient to stay in the comfort of their own home and they don't have to travel very far. A disadvantage, I found it to be a challenge in building rapport, just because it's difficulty to pick up those nonverbal cues.
And an advantage as a pharmacy student during the telehealth is Patient, there's easy communication with patient, and patient is convenient wherever they are. And a disadvantage is there's misinterpretation and miscommunication sometimes to interpretation of words.
As a DO student, some of the advantages that I've noticed are when working with an interprofessional team, it allows for efficient transitions of care throughout the patient's course of treatment, and it also utilizes a shared decision-making model, which helps patients' outcome. And the disadvantages are that you lose some of the body language cues that you might pick up in person over Zoom, and you lose out on the ability to use such things as empathetic touches on a shoulder to help comfort the patient.
What we learned from this experience was how to collaborate with other professions, how to effectively utilize telehealth and interact with patients and clients via telehealth. And that included being able to properly communicate with the client and in the best interest of their needs.
Some of the things that we would have done differently include better communication between sessions and make sure the patient has a good follow-up plan and make sure they're meeting all their treatment goals.
We want to thank Mary and Z for being our supervisors during this experience, and we really learned a lot. And we want to thank CECE for letting us be a part of this team immersion.
Hello, my name is Marissa White, and I will be presenting on a multidisciplinary collaborative project in which a team of students developed a pamphlet for malaria prevention and treatment in Ghana. Today, I will be representing our student-led interprofessional team and the product we developed during our time in the remote Ghana cross-cultural health immersion program at UNE. Let me introduce you to our team. Myself and Renee are in the Master of Public Health program. Anna and Catherine are from the nursing program, and Kirsten and Victoria are from the pharmacy program. I'll first frame the health issue we sought to address. Malaria is a disease that is caused by Plasmodium parasites, which are spread to people through the bites of an infected female Anopheles mosquito. Malaria is dangerous, especially when left untreated, because it can cause severe complications and even death. Malaria is a major cause of illness and death in Ghana. In 2019, 6.7 million people in Ghana were reportedly diagnosed with malaria, and 336 people died from the disease. Malaria has the highest disease expenditure. The cost of care and treatment, as well as the number of days lost, place a major burden on patients and their caregivers. To address the issue of malaria in Ghana, we developed an educational pamphlet on malaria prevention and treatment to be piloted next spring when UNE students travel to these southwestern Ghanaian villages. In developing this product, we collaborated as an interprofessional team. We each brought a different perspective or lens to the project in order to tackle the issue from multiple angles. First, we gathered extensive information on the health issue and population of interest. Next, we selected a type of appeal to encourage patient behavior change and then drafted the pamphlet using an online design and publishing tool. Then we sought feedback from our stakeholders and made revisions based on this feedback, as well as the CDC's Clear Communication Index test that we ran on the pamphlet's written components. Lastly, we finalized the product for implementation. Thank you for taking the time to hear about our work. Please visit the following link to view the full presentation, which is about 22 minutes in length. We look forward to answering any questions you may have during the Q&A session.
This is going to be the Sled hockey group. So if everyone from that group who is here could just give a wave and introduce yourselves, that would be awesome.
Hi, everyone. So there's a big group of us here, and then there's a few that are on separate Zooms. So I'm Kayleen Mulvihill. I'm a third-year DPT student.
I'm Teresa. I'm also a third-year DPT student.
I'm Callie. I'm also a third-year DPT student.
I'm Megan, also a third-year DPT student.
I'm Kaylee, a first-year OT student.
I'm Emily, a first-year OT student.
And I'm Maddie, a first-year OT student.
And then if those that are on separate Zooms want to introduce themselves.
I'm Jaden. I'm a second-year osteopathic medical student.
I'm Katie. I'm a third-year DPT student. I'm Abby. I'm a first-year OT student.
Awesome. Thank you.
And David's on the call, so we're good to go.
Throughout the fall semester, our team worked together to host the first adaptive sled hockey event at UNE's Biddeford campus. Our team is a collective interest in adaptive athletics and outdoor recreation, and we were looking for a way to get involved with our community. With immense support from Veterans Adaptive Sports and the UNE community, we developed a successful event for participants from all over Maine. We had over 60 volunteers from UNE's physical therapy program, occupational therapy program, and the College of Osteopathic Medicine. Volunteers were eager to help check in participants, fit them for equipment, and safely get everyone on and off the ice. Each discipline brought their own unique expertise, providing participants the supportive assistance they needed.
The majority of participants had no experience playing hockey and ranged from the ages of 8 to 70 years old. One of our youngest participants was looking for a new sport to play after his adaptive tennis program ended. He was thrilled to have had the opportunity to try sled hockey and even said he wanted it to be his new sport. A mother who was accompanied by her daughter, who played on a youth hockey team, wanted to try adaptive sled hockey so that she could have the experience of being on the ice with her daughter. Now our interprofessional team has begun the process of developing an ongoing adaptive sled hockey program at UNE's Biddeford campus. It is our goal to facilitate recreational activities for individuals with disabilities to develop skills, enhance independence, and provide enjoyment through active recreation. Having access to and participating in recreational sports is integral to a well-rounded life for every person. We hope to create a collaborative experience for all UNE students and for individuals with disabilities within our community.
Our goal for the 2022 spring semester is to collaborate with other sled hockey programs and teams in the New England area to develop relationships and to continue gaining participants for an ongoing sled hockey program at UNE. We are currently seeking guidance from the USA Sled Hockey representative, Taylor Lipset, who is helping to connect our group to sled hockey programs in Vermont, New Hampshire, and Maine. We would like to plan 2 more adaptive sled hockey events at the Alfond Arena. We are grateful to have the support of David Witten, Harold Alfond Forum Manager, and Judy Sullivan, Maine Adaptive Program Coordinator.
As we build participant interest, our plan is to create an ongoing league starting fall 2022. During the spring semester, our plan is to apply for a USA Hockey grant to obtain 5 adult sleds for UNE. We will be doing a hockey equipment drive on campus and in the community to help collect chest pads, elbow pads, knee pads, and helmets for participants. Our next step at the end of the spring semester and during the summer semester is to develop a proposal to apply for a UNE mini grant to help assist in the purchase of youth sleds for the program. Our small team of interprofessionals from physical therapy, occupational therapy, and osteopathic medicine are eager to develop this program in an effort to bring a new, unique adaptive sport to the community. Students from UNE's health professional disciplines will have the opportunity to utilize their skills to help community members participate in an adaptive sport. This collaborative program will be an enriching learning experience for
Again, what an impressive, that was like a professional presentation slideshow. I'm just, again, very impressed with the second presentation as well. I don't see any questions in the chat. So I just was shocked that the mom and the child, her daughter, played together. So could you talk about the young boy? Could he bring a friend that that's able-bodied to play in the league? And it was such a diverse, I think 8 to 70 years old. So can you talk a little bit more about the league and who can be involved?
Yeah, so as of right now, our next goal for the spring semester is once again to have 2 more events in order to get more participants to show up. If possible, we'd like to do a youth league as well as an adult league. As of right now, it's going to be more adults and youth just playing together until we have more participants and the program grows. But so speaking of the mother and daughter duo, so the daughter actually plays on the youth team and she was playing at the UNE arena that day. And her mom has never been able to go on the ice with her, even when they have like a mother-daughter day on the ice for her team. So her mother's goal was always to just get on the ice, and this made it possible, and they were able to skate together, which was honestly one of the most rewarding experiences.
Wow, that's just got me emotional. Yeah, that's amazing.
As for the little boy, I would say absolutely. He can bring friends. It's really open to anyone, even those that are able-bodied, just to try it out. We're hoping to have the ability to give that opportunity to students too, to try out, just so that they have a better idea of how it's performed and how it works.
Okay. Excellent. Does anyone from the audience have any questions? Sorry, I'm looking at you all, but my camera is on a different view, so I apologize for my weird angle. There's nothing in the chat. We do have a couple minutes for another question.
And if there's no questions, honestly, like, this is a new program, and we would love all of the help, all of the assistance that we can get. A lot of us are third-year DPT students, so we will be heading out on our clinical next spring. We'll of course be reaching out and making sure that the program continues on, but for those who are going to be on campus, staying here longer, we'd love for your support. We'd love for your help, because I think this is going to be an incredible opportunity. So we just want to get it off the ground and really go for it.
I love the shout out. And there is another mention for those of you who tried the equipment. What surprised you most addressing able-bodied versus those with the adaptation needs? And then do you need to have hockey experience to volunteer? So if you can quickly answer those questions.
No hockey experience. Honestly, you don't even have to put skates on. They have little like booties to put on to protect the ice with your shoes. None of our participants had played hockey before, so it was all brand new to them.
Excellent. All right, we're going to move on to the next presentation. Well done. Congratulations all.
Thank you.
Hello, everyone, and welcome. My name is Jessie Caton, and I'm here with my colleagues today to present our poster on Social Determinants of Health Month, the expansion into interprofessional education. I'm here with Belle Bokel, Austin Vaughn, and Katie Santinello, and we'd first like to thank our faculty mentor, Dr. Shelley Cohen-Conrad, for all of her support throughout this initiative. The Social Determinants of Health Month initiative was started in 2020 by now third-year COM student Alyssa Ahern and COM Student Club Physicians for Social Responsibility, in hopes that COM and broader UNE community would engage in discussions that are difficult but necessary. Throughout this initiative, UNE students and community members are encouraged to explore conditions in which people live, grow, work, learn, and age in that impact individual health, while also learning about systems of oppression that perpetuate those conditions and disparities in healthcare. Students and faculty are encouraged to reflect on the difficult conversations held during this month and utilize the various resources available to them on the website we have created for further evidence on the topics and how to address them. We hope through this initiative, students and faculty can continue to build cultural humility, which places greater emphasis on lifelong nurturing of self-evaluation and critique, promotion of interpersonal sensitivity and openness, addressing power imbalances, and advancement of an appreciation of intercultural variation to avoid stereotyping. And now I would like to hand it off to my colleague, Belle.
Thank you so much, Jessie. A huge part of this month was, of course, having events at the Social Determinants of Health Month, but more than events, there was a component of interprofessional engagement, which is huge at UNE. These events will encourage participants to think about how we might affect positive change in our communities and in our future patient populations. This year, over 15 clubs and organizations across all of the health professions came together to host guest lecturers, students, and physician panels, community volunteer opportunities, and other alternative opportunities for the UNE community to learn about social factors, impacting health. Now I'm going to pass it over to my colleague, Austin.
Thanks, Belle.
As Belle just mentioned, over the course of this month, students, faculty, and other members of the UNE community attended events both virtually and in person. And some of the programs represented included the College of Medicine, Physical Therapy, and Social Work, amongst others. While the expansion to other programs marks a landmark moment for Social Determinants of Health Month at UNE, the data shows there's room for large improvements incorporating the Portland campus into SDOH efforts. Some of the ideas being discussed to progress SDOHM at UNE include earlier collaboration with all UNE graduate programs and CECE in order to give ample time to plan events, continued seeking of funding to support larger efforts, and potentially changing the month in order to avoid a holiday week and shorter days, which can have an influence on nighttime attendance. A final upcoming change, which will have a positive impact on these efforts, is the transition of the College of Medicine to the Portland campus in the fall of 2024. And now I'll pass it off to my colleague, Katie, to close.
Thanks, Austin. So we'd just like to again acknowledge Dr. Shelley Cohen-Conrad, as well as the Center for Excellence in Collaborative Education for funding the Social Determinants of Health Month events. We'd also like to give a big thanks to the Office of Research and Scholarship, as well as the Unicom clubs and organizations who participated, as well as COM-RSAS. Thanks so much, and we look forward to answering your questions.
Excellent job. I am so impressed with the trailblazing and leadership of the students and the student groups. This is wonderful. Something that stands out, thank you for putting the Social Determinants of Health website into the chat. Is it Jessie or Jess?
Jessie.
Jessie. So my question is, I think it can create a lot of potential publicity, engagement by the students, because you're talking about changing the month. So how would that be done? Did the first student group just pick November, or is it established based on a larger organization that November is the month? I'm just curious.
So this was when we started this last year, we just kind of randomly picked November. There wasn't really any rhyme or reason to it. So moving to having more of the interprofessional aspect to it and having more collaboration, trying to find a better month that works for everyone is one of our biggest goals moving forward.
Good luck with that. This is wonderful. So there is a question: what were the benefits of having an interdisciplinary group work on this project?
Sure, I can take that, Jessie, and we can maybe popcorn it around the group. So again, Belle, second year social work. I had worked on a few different interprofessional teams with my friend Katie Santinello, who is actually on this team as well in COM, and had just been a big fan of the Social Determinants of Health Month that from their website. And maybe it was my own implicit bias and confusion. I wasn't sure if the language, we were in virtual learning last year to keep our community safe. And I just wasn't sure if the events were for everyone, or, I think sometimes depending on the type of learner that you are, you might not feel comfortable going to another club or another school's event and not know anyone. I would be, but not everyone is. And so I'd ask Katie if she knew Jessie, if she was involved with Social Determinants of Health Month, if she had gone to any of the event programming the year before, and if she would facilitate an introduction. Jessie and I did a Zoomie and we just hit it off, and I asked if she was interested in making it interprofessional. This is kind of social work's bread and butter. It's our curriculum. It's in our code of ethics. I approached Dr. Cohen-Conrad and I asked if she would be interested in reading a mini grant, if I would write it, and approached Jessie if she knew about this as a form of funding, how she had funded it the year before, if SGA was involved. We have GAPSA here in Portland, just kind of what was going on, and it just took off from there. And so to the question in the chat about, the benefits of having an interdisciplinary group work on this project, I think of it, I always go back to sports teams, or if you were in band, we all bring different skills to a project. And I think that was what I took away from it, but I'd love to popcorn it to the team.
So we have another minute to hear from others.
Yeah, I'm happy to add to that, but also I see that there's a hand up. Was there a separate question that was looking to be asked before the end of the session?
There is, but go ahead. I don't want to stifle the conversation here. Keep going.
Sure. So I can add a little bit onto what Belle just said. And I guess this is somewhat anecdotally. But for example, the Pediatrics Club, one of the events we put on was about adverse childhood experiences. And Belle, although she's not in the Pediatrics Club because she's not in the College of Medicine, was able to come down and give a beautiful presentation that was really insightful and kind of add her own point of view and experiences on those and educate some of the people in the College of Medicine on adverse childhood experiences and the kind of health effects that it has. Again, similar kind of what Belle was just saying. I think that the more people and inputs that you have, and obviously expanding the amount of people that are contributing to this month as a whole, the more unique experiences and perspectives that you have. And I think that social determinants of health is not just pertaining to, one particular field in healthcare, but across the field. So being aware of not just, how implicit bias or, fat bias or any of the other topics that we talked about affects not only, the perspective of doctors and physicians, but also of, social workers and pharmacists and OTs and PTs, I think is really helpful in order to make sure that we're kind of keeping a much larger view about the effect of that and how we can try to continue to impact change. So.
Thank you, Austin.
Mistrust among patients for the healthcare system isn't a novel concept. However, it has been gaining more ground and more following since the beginning of the COVID-19 pandemic. Our simulation patient, her name was Amanda. She was a 39-year-old female, and she has had some pretty negative experiences with the healthcare system, and she definitely has a lot of mistrust among or for the healthcare system. She's somebody who values non-pharmacological therapy and wants a team who shares her values as well. She fell very sick from COVID-19 earlier this year in April 2021. She did not have a COVID-19 vaccine. She was in the hospital for 11 days and she was intubated for 6 of those days. She now struggles from long haul COVID. Her big symptoms are chronic migraines, fatigue, shortness of breath, and intermittent coughing. And she was recently diagnosed with hypertension from her COVID illness. She came to us seeking therapy for her family and support for her family. She wanted some solutions to her symptoms that she was feeling, but she really emphasized the importance of help for her family as not only her. We were able to connect her with some therapy for her family that was easy to access for her husband and her 2 children. Our PT student suggested some techniques to help with her chronic headaches and her migraines. And the PA student, which is me, Lindsay, was able to, or wanted to discuss with her the possibility for the need of pharmacological therapy for her hypertension if it did come down to that point. After monitoring for a while, that discussion was not received well, so we didn't have much solution for her hypertension. But the big takeaways we took away from this simulation experience, we learned skills on how to approach a patient who mistrusts the healthcare system, and how to kind of instill our confidence within her by getting to know her and making sure that she knows that we understand her values and we acknowledge her. We learned how to collaborate with one another to develop a care plan that shares our patient values in mind while also using the knowledge we got from our training. We also learned the importance of when to say that we may not be the best person for the job, and when to connect her to somebody who may better share her values or hold her values, and give her both the support, the psychological support, and the physical support for her symptoms and that she's experienced from COVID. Overall, it was a great experience. I think all of us took away some pretty fantastic skills. I don't think any of us have had an experience with a patient who resists treatment at this much, and it was definitely a very challenging experience, but I think all of us took away quite a bit, and I'm very grateful for the experience. Thank you.
Hi, my name is Hannah Ockery, and I'm a 3rd-year medical student at the University of New England College of Osteopathic Medicine. I'm presenting on behalf of my interprofessional team for our research project entitled Crossdisciplinary Care After ACL Rupture with a Telehealth Perspective. Our team included myself, an allopathic medical student, a physical therapy student, occupational therapy student, and undergrad from the public health program. We were tasked with coming up with a patient care plan for our simulated client who had suffered an ACL rupture and subsequent surgical repair for her ACL tear. This patient had unique socioeconomic limitations and other restrictions regarding her mental health and her access to healthcare and transportation given her rural location. So social determinants of health definitely played a factor in our development of the care plan. I just want to share with you some of our conclusions that are applicable for anyone going into healthcare who might face a scenario where they're speaking with a patient through the computer. We concluded that patient trust is a critical aspect to gathering clinical evidence, especially when this in-person bond cannot be formed. We designated one team member to periodically check in with the patient, and we concluded that this proved very effective. We concluded that physical exams have limitations on the telehealth platform. We concluded that transitions from one team member to another on a virtual platform require practice and organization. Additionally, this team who's interacting with the patient on a virtual platform should prepare for technological issues and how they will handle them. It's almost inevitable that throughout the course of speaking with a patient or throughout the day of speaking with multiple patients, there would be technological issues, and we had prepared for how we would deal with that as a team, and it was seamless. Extra attention should be paid when screen sharing on the telehealth platform. This was unique to all of our learning experiences in some who are unfamiliar with Zoom. And in the healthcare setting, personal health information should always be protected. We also concluded that patient privacy could be difficult to manage on a telehealth platform. For example, our client, our simulated patient's boyfriend walked behind her while we were doing a physical exam. She was okay with this, but if this was a real scenario, in someone's home, it's often difficult to make sure there's complete patient privacy. And lastly, we concluded that an interprofessional care team is necessary to create a holistic care plan. I invite you to look at all the aspects to our care plan because it's a really diverse care plan. It plays on strengths from all of our backgrounds. And I can personally say that I learned from all of my colleagues in how I will build out my care plans if I don't have these members of my team directly playing a part in the patient care. I hope you're able to learn from all of our experiences too. Thank you.
Hello, everybody, and welcome to our poster. Thank you so much for coming to visit today. My name is Michaela. I am a student in the Doctor of Pharmacy program, graduating in 2022. I was fortunate to do this research with 3 colleagues. First is Belle Bogle in the School of Social Work. Additionally, I have Katie Santinello and Will Rinaldi in the College of Osteopathic Medicine. So this is an interprofessional group doing this research, and we look forward to sharing our experience with you. Our poster is titled A Study of Student Involvement in Interprofessional Work and the Impact of Health Professional Preparedness to Collaborate in the Workspace. This poster highlights our belief that interprofessional education has benefited our clinical practice because our experience have taught us a collaborative approach to healthcare. Throughout our study, we seek to understand if our experiences align with those of the broader population. We believe that interprofessional approaches to educating future healthcare leaders and placing an early emphasis on collaborative education can improve the delivery of services and patient care from future providers through enhanced collaboration with other healthcare professionals. Interprofessional education may also reduce interprofessional challenges in the workspace, which can hinder professional practice. The purpose of our experiment is to determine postgraduate preparedness and comfort with collaboration in the workspace, to analyze pedagogical methods of each discipline and the impact of integrated IPE, and lastly, to assess if an interprofessional opportunity improves students' preparedness to collaborate with professionals outside of their respective discipline. Our study questions are the following. 1, how does interprofessional education impact students' attributes in their work or scholastic environment? 2, how does each professional program approach and apply the topic of IPE? And is participation in IPE even encouraged to begin with? Finally, how does participation in IPE prepare a health profession student's future ability to collaborate with professionals outside of their profession? Our methods for the study are as follows. We will utilize the University of New England's alumni network to recruit participants for our study. All participants of our study will have graduated in the past 3 years. We will survey all of these participants to find out how much they were involved relative to each other in interprofessional work while they were on campus. We will also be holding focus groups to try to uncover some larger themes. We will offer financial incentives in the form of electronic gift cards to our participants in the focus groups and an entry to win a gift card to those who are participating in the survey. The focus groups will be at maximum 5 people per group, each led by a student researcher. And we will conduct the focus groups via Zoom and record these encounters utilizing Zoom to generate a transcript. This study is still in progress, so we look forward to sharing our results with you in the future. Please let us know if you have any questions. You can email us at my email. It's mmeyerson@une.edu. Thank you so much.
Hello, I am Kelsey. I am here with Arjmund, Madeline, Kelsey, and Riley. Our project is expanding our scopes through interprofessional care and long-haul COVID. Interprofessional collaboration is an essential portion of patient care as it improves patient outcomes and in one study has even been shown to reduce readmissions into the hospital. In this project, students of differing professions work together to manage a patient with long-haul COVID.
Our patient is a 39-year-old woman hospitalized for 11 days in 2021 for COVID-19. She was admitted to the ICU and intubated. She was discharged 5 days later and spent the next weeks trying to feel better before going back to work. Shortly after discharge, the patient began experiencing excessive fatigue, cough, brain fog, shortness of breath without exertion, hair loss, and loss of taste and smell. She complains that her most debilitating symptom was migraine headaches. She has a previous diagnosis of exercise-induced asthma for 20 years and high blood pressure. She was not vaccinated prior.
Coming from the allopathic medicine and PA point of view, our plan is to examine and evaluate the patient's past medical history and social determinants of health to fully assess the patient's current health status, along with determining appropriate treatment options. Our assessment, the patient seemed to have been experiencing headaches that were limiting their daily routine, a cough, and really had been struggling with getting enough sleep and feeling exhausted. The patient really seemed distraught and frustrated with the symptoms. The biggest frustration seemed to stem from the patient feeling as though no one was understanding how difficult the situation was for them, the financial burden they were undergoing, and not being able to provide for their children the way they want.
From a pharmacy perspective, I evaluate the patient's medication list and their past medical history. I want to make sure each medication has an appropriate indication. I also check for drug interactions to make sure nothing on the patient's medication list nor their diet interacts with any of the medications they are currently taking. I also evaluate the patient's complaint list to make sure that none of their complaints are a potential side effect of any of the medications. If a medication was causing a side effect that the patient didn't like, an appropriate recommendation would be made to the allopathic medicine student or the physician assistant student.
The plan for occupational therapy was to evaluate the patient's strengths and challenges to occupation in the context of values and motivations, roles, routines, and current environments. The patient reported no feeding or eating difficulties post-intubation, but did report feeling fatigued and short of breath after ADLs and IADLs. Specifically, the patient felt they couldn't fulfill the demands of a full-time job and providing care for 2 young children. Despite these barriers, the patient's strengths lie in her motivation to change. Occupational therapy recommended walking to decrease stress and increase cardiovascular endurance, utilize energy conservation techniques, and increase community mobility by ride sharing. Education interventions were utilized by the entire team to increase awareness of current COVID-19 evidence.
In conclusion, an after-school program was suggested to help look after the children during the day when both parents are at work. Support groups were mentioned to help the patient know they are not alone and validate their feelings. Propranolol was recommended for headaches.
Hello, everyone. We are the Holistic Whales. This is our poster, Dismantling the Hierarchy, Interprofessional Collaboration for Best Patient Outcome. Our objective is to utilize interprofessional team collaboration to develop skills to create the best plan of care for our telehealth patient. We are a group of health professional students from different programs working together to create a holistic plan of care using motivational interviewing, including our patient's family, into the decision-making and using a multifaceted approach in order to address all aspects of patient care. Our patient is Amanda. She is a 39-year-old female who is hospitalized for COVID. After she was discharged, she began experiencing symptoms of long-haul COVID, and she was referred to us. She has a partner, Mo, and her 2 children, Karis and Bennett. Her goal is to find out why she is still having symptoms, to address her fatigue, headache, and stress, and to find a better way to feel better and back to herself.
For our interprofessional goals and collaboration, we were able to engage in realistic patient interaction, while also participate in active listening, and motivational interviewing with both our patient Amanda and the teammates. We learn how to balance multiple professional perspectives to help the patient navigate their stigmatized condition.
During telehealth session 1, we practiced motivational interviewing and asked guided questions to create a better understanding of Amanda's current and past history related to her diagnosis as an interprofessional health team. Through this process, we validated Amanda's feelings and legitimized her long COVID diagnosis while developing a treatment plan.
In session 2, we used the information gathered from session 1 to create recommendations in our interprofessional team. And we also included Amanda's partner, Mo, in the decision-making as well.
Each participant had their own takeaway, but our large conclusion was that we felt lucky to be placed on a team where each person felt knowledgeable, respectful, and motivated. There were key factors that we prioritized in order to best achieve the outcome for our patient. All participants worked to better understand each other's profession, asking questions regarding their scope of practice and how we could best support the other or fill in gaps. We genuinely approached each person and their profession as an asset, not an obstacle. We worked to understand each profession's approach and that each approach brings valuable information to help our patient holistically. Most importantly, we remembered that our common goal was to help Amanda.
I'm Kelly Fox, and I'm the faculty facilitator, and Elise is our student facilitator.
So next presentation is Westbrook Housing Authority Educational Seminar Series.
Hi everybody, my name is Marima and I'm an OT student at UNE and I'm representing the Westbrook Housing Authority Educational Series poster for my team. My team members include Erica, a PT, Alex, a PT, Angela, an OT, and myself, an OT. My team, some background information from Westbrook Housing includes that the Housing Authority provides affordable housing for families and adults over the age of 55. Currently, there are 555 affordable housing opportunities for seniors living throughout Westbrook, Maine. We can thank Tom Muser for establishing this connection with Westbrook Housing residents through the UNE's Center for Excellence in Aging and Health. Tom and his staff worked hard to perform a needs assessment and create events that would be meaningful to the residents at Westbrook Housing. This was when the Westbrook Housing Educational Seminar Series was created with various wellness topics that residents would be interested in, which include pain, balance, nutrition, goal setting, use of adaptive equipment, and technology use. There was a collaboration between PT and OT students for each educational seminar to create well-rounded representation for the residents. We have learned that collaboration is key in developing our future careers as we will work closely together to improve patient outcomes once we enter into our professional fields. We found that the best patient care models are through transdisciplinary care models, and this has allowed us to provide our residents with well-rounded presentations that apply to their everyday functions. After completing the first seminar on pain management, the residents were super interactive, and we wanted to provide them with something more. So we created the Westbrook Housing Authority mini grant to fund different wellness prizes to provide to residents following the seminar. The goal of these prizes was to promote healthy habits among residents and continue to increase attendance from the Westbrook Housing Authority residents. We have had 3 presentations in total so far and will continue them into the spring semester. We are so thankful we can establish a connection between the residents of Westbrook Housing and the therapy departments this semester. We hope to continue to provide services in the future and continue to provide more services in the future. We want to thank all the PT, OT, and social work faculty that have established and supported this project. This project was funded by the Centers for Excellence in Collaborative Education. We want to thank the Office of Research and Scholarship and Brian and Deborah Dallaire for their ongoing support. We would also like to thank the Pharmacy Department and Tricia Mason for contributing resources to the Westbrook Housing Authority grant. We would also like to thank Chris Hall and Michelle Coe for assisting us throughout this process. Again, thank you so much.
Thank you very much for your presentation. That was great. I'm just curious, is there anybody in the room who has any questions for our presenters? have a question. So what surprised you the most about this collaboration? And is there any member of the team that you wish you had?
So I can answer that. My name is Erica. I think the biggest surprise for me was understanding a different perspective, because in physical therapy school, you learn how to be a physical therapist, you learn how to help in that aspect, but it was really neat to hear how OTs help also in the same aspect, but in a different way. So it was really cool just to have the interprofessional interaction to help us gain more knowledge of different professions. In the future, we would love to have more interaction with other students from pharmacy and medical, but at this time, because we're starting to get it going, we're just sticking with PT and OT.
Anybody else want to respond to that?
I can add to that. I agree with everything Erica said. My name is Alex. I'm also a PT student. Unfortunately, we don't have any of our OTs here today, but I think in the future, bringing in pharmacy, social work, pretty much all the UNE professions, we could see great growth in this project. The residents are super fun to work with, and they have so many great questions for us and make us keep learning every day. So it's been a great project.
Great. So we have a question in the chat from Dr. Cramsey. Anything related to the grant writing for this mini grant that you anticipate bringing with you into your practice? And do you have any advice for other students pursuing mini grants through CECE?
That is a great question. I feel like by collaborating and writing this mini grant, it helps me tremendously to understand the importance of actually collaborating as a team and taking like a leadership role in a roundabout way to help so things get done right. I think for the future to help other students it's worth it. It's a lot of hard work, but seeing the joy that it brings to our grant, the grant that we have, it brings to the residents has really helps me a lot to realize that I'm really glad I wrote the grant to help them, but it also helps me to be more professional in the future.
I would also add that throughout the grant process, we definitely had a lot of mentors, faculty mentors. Dr. Cramsey was one of them. So it was super helpful to reach out to them as well and just keep getting feedback on what we can improve and kind of work as a team to figure out how we can make the grant accepted.
Thank you so much. And Elise says, as someone who participated in the Westbrook Housing Project, I just want to highlight how wonderful of an opportunity it is for older adults. There was so much socialization, laughter, and education gained from the session. Thanks for that addition, Elise. Anyone else? I think we're just about, I think we have to move forward now. So thank you all for being here, and thank you for your wonderful presentation.
So our next group is Ghana Cross-Cultural Health Immersion Medication Label Redesign.
This is our project. It's called the Ghana Cross-Cultural Health Immersion Medication Label Redesign.
Hi, my name is Lisa. I'm a student at UNE.
Hi, my name is Sarah May Rose. I am a second-year pharmacy student at UNE.
Hi, my name is Megan Larson, and I am a public health student at UNE.
And I'm Shannon. I'm a pharmacy student. I'm a first year. We also want to thank Dr. Saeed Wasti and Emily Hand, a nursing student, for also participating in this project, and Dr. Rachel Mayer and Jennifer Seedy for being our mentors. And here's just our presentation outline. We're going to go through the background. We're going to go through the audience, the products that we produced, and our next steps. And I'm going to hand it over to Lise to get started.
We found out that health literacy and health communication is a major concern in many cities, town, healthcare cities in Ghana. So we're going to go over some audience. So for the audience, Ghana has some patients and healthcare workers. It has urban, but 79% completed primary high school.
So the product that we designed was a medication label for prescription medications that patients take home with them. And we implemented various implements from the previous label and then used some feedback from some community health workers from Ghana that we met with. And then what we concluded from that was pictures were better than text overall, and then numbers were better than just written instructions. So 2x1 versus take 2 tablets once a day. And then that previous medication label right there is what we built our new label on.
Based on the feedback that we got from James and Richard, who we connected with from Ghana, and then using the knowledge that we gained from our schoolwork, this is what we came up with for the updated label. Just moving things around and making minor but effective changes. And to implement the process change of using the label, we did the needs assessment of the community. We researched, developed the implementation, the new label. Now we got to implement and evaluate the impact. We developed some community healthcare training, community healthcare worker training that will be used to allow the community health workers to become content experts on the label.
So the evaluation tool for healthcare workers that we developed is based on a 26-point scale. And based off the score, we either need to re-educate the healthcare provider, and depending on the distribution of those scores for all of the healthcare providers, we either need to change our label or it's considered successful. And this is the patient usability tool we developed. It's got yes or no questions, and basically the healthcare provider scores it to score the patient's understanding. These are our references, and we are wondering if you have any questions.
Thank you. Are there any questions from people in the audience? Mike or Megan?
Megan's hand was up first if she has a question.
I don't, sorry. I was part of the group and I forgot to put my hand down. Sorry.
I always have a question. Shelley knows I always have a question. So that was awesome. And as I, was listening to your presentation, it's very much a design thinking process. The parents to mind where you iterated on, in terms of what would work, and you were evaluating in real time. How does this work? My familiarity with the Ghana program is we're there for a brief amount of time, and the ability to have impact, sustained impact over time. So what are your thoughts about, something like this that continues to improve? Is it now the case folks that are actually on the ground that have the skill set to be able to continue to further improve on? I mean, it's awesome what you created. And I'm wondering, sort of the ongoing evaluation and quality improvement thing. So how does that work in a program like this?
I think from my understanding, I think the ongoing improvement process would still be a collaboration with the University of New England in conjunction with the community healthcare workers, using specifically what we developed, the evaluation tools, to hopefully give us a snapshot of how the updated label is working for the community. And we did do like a percentage criteria. So based on the results from the evaluation, there would be re-education for the patients or the community healthcare worker, whoever is having the evaluation, or if the results are unfortunately low enough, that would then trigger the label to be sent back to UNE for further evaluation for future students. So I believe what the plan is to have the label evaluated with the evaluation tools, go back, that information will go back to the cross-cultural program, and then it will be evaluated if things need to be improved upon again. Still going with the same framework of this go round with UNE students working with community healthcare workers.
Is there a mechanism for sustained communication across the year?
That I don't know, unfortunately.
Yes, I think Dr. Jen Morton and I think Tricia Mason are are in communication with the folks that we collaborate with in Ghana on a regular basis, from the University of Cape Coast, as well as the folks on the ground in Takoradi and Sekondi. Any other questions? So I'm curious about how it was to collaborate across disciplines for this project, considering that you all weren't pharmacists, you all weren't public health people, and this was a cross-disciplinary experience or interprofessional experience. I'm curious what that was like for all of you.
I can start off by just saying that I thought it was really interesting to kind of see it from like two different perspectives. From a pharmacy perspective, for me, I was more focused on the actual like drug information, while from a public health perspective, it felt like a lot more of a macro look at everything, of like investigating exactly how the label worked and how effective it was in the population as a whole versus just for each individual patient, was just kind of like really interesting for me. I know Megan, you worked a lot on the evaluation tool and everything, and I thought that was really interesting for me anyway.
Yeah, I found it was a great experience. I do think that this particular project really suited an interprofessional group really well. I think that for public health, we want to improve the health of the world or a whole population, and are focused more on preventative measures. And then I think the pharmacy perspective was great to have, just because of what we were working on, the prescription label, making sure that we had all the necessary requirements on the label itself, and then nursing too, with the aspect of patient care. Is really important to make sure that we consider that as well. So I really do think that this particular project worked really well with our group.
Well, I think our time is done for today. There is a link for the attendance in the chat box. Thank you all for your presentations and for all the great work that you're doing. And I really appreciate your taking the risk of working interprofessionally and learning what that's all about. So thank you very much. Have a great rest of your afternoon.